obvious benefit is that they know the diagnosis, and because of that, they can say, my child has a diagnosis of Niemann-Pick type C disease, rather than my child has a neurological condition, but we don't know what it is, we don't know what the prognosis is, we don't know what to expect in the future. So that, of course, is beneficial. You can predict, but of course it is a terrible disease. The other benefits are that there is a treatment that can be offered, and the earlier you offer the treatment, the earlier you would hope you would be able to slow down the progress of the disease. So these are clear benefits. The other benefits are for family counseling, for prenatal diagnosis. There are other benefits as well.
The value of an early diagnosis is better outcomes and more functional capabilities of the patients. It's much better to treat at an early stage than to stop the disease process at a late stage. So it's very important to recognize the symptoms in the index patient, but also then look for siblings or other members of the family who might also be affected by Niemann-Pick disease. I think it's very important that physicians and other healthcare providers know about Niemann-Pick disease, despite the fact that it's a rare disease. It's a treatable disease, and you should check for the obvious symptoms of Niemann-Pick disease to treat early.
When they have Niemann-Pick type C disease at the back of their mind, that will help to diagnose these patients. At least think about it, send them to the referral centers where the diagnostic tests could be done. I don't think it's a problem now, the access to the diagnostic tests. We have this now. So it's a question of recognizing the signs of Niemann-Pick type C.
The fact is that many of the symptoms of Niemann-Pick type C are not very specific, and many patients who is present with psychosis or cognitive decline or cerebellar ataxia that can be encountered in many other diseases. So the challenge is to recognize Niemann-Pick type C among all the other potential disorders that can cause the same kind of symptoms.
This international campaign will hopefully lead to clinicians thinking about these rare diseases, particularly Niemann-Pick C, sooner rather than later.
The goal is really to teach physicians to put awareness first about the possibility of the disease, because many physicians don't know that the disease exists. They have never heard about Niemann-Pick type C. And the second thing perhaps is to teach them how to recognize some very specific signs of the disease, such as the vertical supranuclear gaze palsy, because this is a very specific sign that almost all the patients with neurological symptoms have. So it's very important for the neurologists to recognize this symptom.
I think the major impact of the campaign should be to find patients that hadn't had a previous diagnosis of Niemann-Pick C, that have probably gone several years with fairly obvious symptoms that nobody's linked together.
This healthcare awareness campaign is aiming to achieve improved awareness of the diagnosis of Niemann-Pick type C, of the signs and symptoms of the Niemann-Pick type C disease among the clinicians of different specialties in various countries throughout the world. And the aim and the goal of this campaign would be to diagnose patients earlier, to diagnose more patients, and to allow these patients access to treatments and the supportive measures that could be put in place for these patients.